Welcome to a short video on misconceptions in clinical trials. First, let's look at what a clinical trial is and what their goals are. A clinical trial is a type of medical research that involves everyday people, consisting of healthy individuals and those with rare conditions. Clinical trials such as the one shown in the First in Human series aims to treat patients and hopefully find a way to save them, along with discovering new advances in the medical field. Next up is the role of the patient in a clinical trial. Patients are vital in all clinical trials, as without them, clinical trials could not be carried out. They help give results to researchers, explore uncharted territories with them, and also risk their own health for a greater good. Now, let's move on to the differences between clinical trials and medical treatment. Clinical trials are used for research and treatment, while medical treatment is mainly used, for a lack of better words, to treat people. With this being the case, the results in a clinical trial may vary, while medical treatments have an expected result. This leads to clinical trials having different levels of risk and benefits, while the risk is usually low in tested medical procedures. You may now be at home wondering, what can I expect from the before and during of a clinical trial? Clinical trial patients can expect to be told what can happen and what will happen during a clinical trial. With this information, they will decide whether or not they want to participate. Patients can also expect to have multiple checkups with the researchers to describe any changes, how they are feeling, or to report other information, such as their diet. Finally, let's look at the risks of participating in a clinical trial. Risks involved with clinical trials can come in the form of a failed treatment plan, side effects persisting from the trial, or by just generally making your health worse. In some cases, death can be the final result, either through succumbing to the disease being treated and researched, or from the treatments used. Although there are risks in clinical trials, sometimes these risks are better than what would happen if nothing is done instead. Many see clinical trials as a last resort, and these are one of the reasons why people may choose to participate in a clinical trial. Other reasons to participate in a clinical trial may include wishing to help others by finding new treatments and advancing science, having more information about one's body, or having more care and attention from clinical trial staff. I hope these explanations have been sufficient enough to clear the common misconceptions about clinical trials.